Welcome, Facebook. We are thrilled to have you here with us tonight, joining us on this live Facebook interview. And I am Dr. Staci Swim, and I am a professor at Oklahoma City University, Kramer School of Nursing. I am also the creator and founder of FrontLineNurse Facebook page and FrontLineNurse.com. That is an initiative that I started with my husband to help give back to nursing as a profession in ways that can help nurses that have been affected by COVID-19. And today I have the privilege of interviewing two nurses from the New York City area that are here with us to kind of share a little bit of their journey with COVID-19 and how it has affected or changed their practice. I have Piera Frisina with us. She is a native New York nurse that has been working in the same New York City hospital for 15 years. She is a peds nurse, pediatric specialty for 15 years. And also she is attending currently in a pediatric nurse practitioner program to become a pediatric nurse practitioner. She also has 3 children that she had bragged to me about earlier in our talking before we started our Facebook interviews. Also, I have with me, and I have to just tell you all that Precious Smith is one of my students that has graduated in 2018. She is a graduate from Oklahoma City University, Kramer School of Nursing, and she is started out her career in a transplant neurological ICU, and then has currently accepted traveling contracts. And she heard of the call for help for COVID units in New York City. And so she knew right then that it was her calling to go help where help was needed to help the profession out. So I'm going to just get started. And I know that there's going to be people coming on and off of Facebook, and I'm just glad to have you all here. So the first thing that I kind of wanted to talk about is, and I think I will address this to Piera, and I just kind of want to know and let you reflect a little bit and share with us, when was the moment, if you remember, the moment when New York, or your hospital in particular, because that's what you know about, but when was it that you guys knew that you needed help, that what you had available for resources as far as nurses wasn't going to be enough? Do you remember that moment in time? Do you remember what you thought? Do you remember if, what solutions were thrown around back and forth? And if you do, if you could kind of share that with us.
I do remember I'm strictly pediatrics. I work in the pediatric ICU, and we were on the slower side because children were not getting sick or even coming to the hospital. So they converted our ICU to an adult COVID ICU. That was talked about on a Thursday, which was the middle of March, probably around March 16th, 17th, around, maybe like the 20th, around there.
Okay.
It was talked about on a Wednesday, it was converted on a Thursday, and on Friday we got an influx of patients, adults, from all other areas of the hospital. The hospital had already made areas like the library and the cafeteria into ICUs just to accommodate the influx of patients. And then, so we had about a 2-week period where pediatric ICU nurses were taking care of adult COVID ICU patients, which I haven't done since nursing school, which was, and now I haven't taken care of an adult since nursing school. So it was an adjustment for a lot of us. And I think after taking care of them for 2 weeks, probably the beginning of April, we were tired. We were exhausted. We just needed help. And I know that other floors of the hospital felt the same way. And at that point, they were already bringing in the travel nurses, which have changed a lot of things, helped us. It was amazing, Us as pediatric nurses then stepped back, and the travel nurses that were more adult trained took over, and we became helpers to them. So we were there just to provide resources. Yeah, and we knew our hospital better than anyone, and we were able to run and get things and make sure things were stocked and help turn patients and help communication with families. We did the background stuff so that they can take care of the patients. And it was a huge relief on us because for 2 weeks we were flooded and we felt overwhelmed, and definitely was very helpful.
So then, Precious, when you felt your calling to go to New York City to help, how did you feel you were received, or how did that transition, what did it feel like?
At first, I was nervous, as expected, but once I got to my unit, the first couple of days I was in the SICU before I had came to the PICU to help out. And while I was in the SICU, they were very welcoming. They would just, have smiles on their faces, and they was like, "Oh, the travelers are here," So they were really happy and excited for us to be here. And it felt really good because I started to hear people talk about, now they can actually take a break. They can use their PTO. Like some people had planned pre-approved PTO, that they couldn't take. And there were others, they didn't already have PTO that they planned on taking, but since they was overwhelmed, they just really needed a break. So while we were here, they have been able to rest a little bit. So, and then also on my first day, on my day off, while I was exiting the building, we seen the fighters was out there. They had their trucks, the siren sign, they had music playing, and then Spades or Sparks is their mascot dog.
Yeah, they had the mascot dog.
Yeah, out there, and they were singing. And they had signs.
They were cheering for us.
Yeah, and cheering for us. Yeah. And
it was great.
Every day at 7 p.m., you have people all over New York banging on pots and pans and yelling and screaming out the window, cheering us on. So that right there was just a big relief.
So you felt
support from the community.
That's something else that we'll kind of talk about later, is that the community coming together, and how does the community come together to support the patients and the healthcare team. So I'm glad to hear you mention that. So I have it's so nice to hear those kind of stories, because traditionally nurses don't play well together sometimes. And so I know that's hard to believe, but if you're in the profession, you know exactly what I'm talking about. And it sounds like that everyone has just pulled together and has just helped wherever they can.
We had to. We
Yeah.
Have a choice.
And that's refreshing. That is so refreshing. Okay, so I have, Piera, I'll ask you this question. When we look at the patient, and the patient, I'm talking about a patient that is a complex system, that you cannot separate the patient from their human and environmental system. And when that happens, like it has happened literally with this COVID war, the patients have literally been separated and isolated from their familiar human and environmental systems. So that includes separated and isolated from friends and families and communities and their familiar surroundings. So during the time, the nurse literally has to be the environment for that patient. You literally are the environment, and you have to create an environment that's conducive to healing. And knowing that some of the patients that you've taken care of are probably not going to heal pathologically, but you can heal in the absence of cure as well. So how in your practice are you creating an environment that promotes positive experiences for the patient, or a healing environment? Has your practice changed any with this specific pandemic?
Yes, I think it had to change because there was no family around, and we didn't know anything about these patients. A lot of these patients we received already intubated, and we couldn't even speak to them and discuss with them their likes or dislikes, or what kind of music do you like, or what kind of shows do you like. There was a lot of guessing and a lot of the one thing I think we did, and I know a lot of the nurses that I've worked with for many, many years, a lot of the travel nurses also, we got to know the families very well. And through them, we were able to figure out what the patient liked and disliked. And a lot of the family members, one in particular, the family would come and drop off his belongings, pictures of his friends and family. We put them all over the wall. We drew on the doors of the wall we have like sliding glass doors. We drew pictures and get well soon and you're doing great. So that when they would wake up and get extubated, they would see that their family was really with them this whole entire time. We had one patient that the family wrote a letter, and it pretty much said his personality, what he liked to wear, what music he liked to listen to, what TV show, his favorite artist, and we played that. I mean, we played that music just for him. We found it on our phones. We put it on. We danced. At one point, he was awake enough that we actually were dancing in the room. All the nursing assistants, all the nurses. It was...
I love that.
We found different ways to accommodate the situation. It was not an easy situation, but we really tried our best to just incorporate the family as much as we could, and we became their family.
Absolutely. So how did you incorporate the family if they weren't able to be there?
We you had iPads, designated iPads, and we FaceTimed with them a lot throughout the day, especially if there was good news, like they opened their eyes, or he smiled for the first time today. We FaceTimed them immediately so that they could see. We had enough staff to do that. We had enough help to be able to do those small things that really are really big things for them.
Yes, I love that. Small things that are really big things.
Yeah.
I love that. You need to quote that. That needs to be on a t-shirt. So then for Precious, I just have, and you kind of talked about it, Piera, but with nursing being a person-centered and relationship-based profession, and that's what relationships. It's all about relationships, and it's relationships with patients, families, other healthcare disciplines, your coworkers. So how was it that, and Piera kind of mentioned or talked about the relationship with the families. So knowing that, kind of what we talked about before we went live, we talked about that everyone is needed, that this whole thing is a team approach. And so can you talk a little bit about what it was like and how it was promoted, the relationships between coworkers and other healthcare disciplines, and even the community? I would like to hear that.
The interdiscipline team worked very well because with these COVID patients, they were really complex. So you would have the intensivist, the pulmonologist, the cardiologist, you have speech therapy, occupational, OT, and PT, and then also
Respiratory.
respiratory, child life from, because usually with kids, they use child life. But since we didn't really have kids, they will also be involved, contacting the family members just to make sure that they kind of stay informed and being able to speak and see their family via the iPads during FaceTime. And I know particularly in the PICU, we would play music for the nurses, not only just for the patients, but we'll play for the nurses. So we'll sing and dance, and even the docs would sing and dance with us as well. So that really helped out. And as she was saying, the travel nurses primarily took care of the patients while they were used as resources. And it wasn't one time where I needed something and they weren't there. They were always available, and they helped out big time because in, really critical situations, if you don't know where anything is, it just makes the situation a lot worse. So being able to tell them like, hey, this is what's going on and I need these things, they were able to get it like really quick. So that really helped out. And also, like I mentioned earlier, the community had been really involved. For maybe the first 6 weeks, we were getting free lunch every single day from just patients' family members, or and dinner and breakfast.
Sometimes too.
And restaurants would donate food. This head wrap that I have on, it was donated from a patient family member had just donated a lot of these. And also they made, face masks. So it has been a really big support system between the patient family member, everyone on the healthcare team, everyone in the community.
That's incredible. That's incredible.
Even, like Target or just grocery stores, they only can allow certain people in at a certain amount of people in at a time. But if you was a healthcare worker, they will let you in. Because there were lines that were wrapped around the building. So that was really, at first I really didn't want to use it, cutting the line. But on days whenever you were really tired and just worked a 12, 13-hour shift and you just want to grab something really quick that you need and get some rest for the next day, that really came.
Absolutely. Oh, I love these stories. This is even more than what I even envisioned hearing from you guys. So another thing is for both of you, that you need to focus on the health and well-being of the caregiver, which is you, as well as the ones that you're caring for. So what is, you kind of address, well, you did address the workplace stress. You addressed, I would like you to expand on maybe self-care. What are you doing to take care of yourself? Also, what, as a hospital, what has been the theme for promoting a healthy work environment? So you guys can each kind of talk about that.
As far as taking care of myself, I think that's been the most difficult part of this whole thing, because I feel like, you know, we were hit so hard here, and we go home, and I mean, at least I go home, and there is no way to decompress because I have 3 kids that are being homeschooled, and I no longer can just walk into my house after a shift. I have to change my clothes and take a shower right away before I can unwind. And luckily, I was not quarantined away from them. I know a lot of nurses in New York were not going home, or healthcare workers in general were not going home. I chose to go home just because my children are little. But I think it's hard to decompress when your world is all upside down, even at home. I try to take a little bit of time by myself and reflect on what had happened during the day, and kind of, I don't want to say forget about it, because you'll never forget about it, but not bring it home. Because my children and my husband, need me to be focused on them and not work. So I tried to disconnect. I played a lot of music while I took a shower, and tried to sing and de-stress before I go with them. My husband's been very supportive, so I was able to talk to him a lot about everything that was going on at work. So he knew when to stay away from me a little bit, or when to come closer. And we did a lot of family outings, even if it was just driving around, just to get away from the house a little and away from everything that was going on. And we have a house upstate. We went there, and it's by the lake, and I sat there and just reflected for a little while. I was able to have that opportunity, which is good. I know for Precious, your family is far, so that's a little harder. But
for me, since I'm staying in a hotel, at first I would just get off work and then go straight to the hotel and kind of stay there. But being in a small room for 8 weeks isn't easy. Even after the first week, it was like, I need to get out. So being able to just go for a walk, I mean, it was a night. New York has a lot of beautiful parks. So just being able to go for a walk or a run just to get some fresh air and also clear my mind, that helped me out a lot. And maybe after the 3rd week, I started getting homesick, missing my son, missing my husband. So just constantly FaceTiming them when I had the time to, that helped out as well. And I hung out with other travel nurses, and even a couple nurses that actually work here at the hospital that we're at. We went on a hike in New Jersey. So that was really helpful as well.
So what you guys are talking about, that what I've heard you say is that it's important to know that nature has healing properties, and both of you have talked about how you used nature for self-care. And just to think a little bit about in some of the research and the studies that I look at, is that even bringing nature, if the patient can't get to nature, that you bring nature to the patient, even in like pictures or sounds, visual or audio type nature sounds, because nature has healing properties. And you guys have just mentioned how it has helped you. So that's just something to think about in your practice, that with these patients that are being isolated, and I don't know, a lot of ICUs don't have windows. So I don't know if your patients have windows to see green space or to see blue skies.
Up here in pediatrics, we do. I'm looking at it right
Yes. Yeah.
There's also a channel on TV, which I just thought about as you were talking. The Care Channel,
yeah.
and it has waterfalls and like, you know,
you
nature.
can
You can hear the raindrops. Yeah,
I forgot all about that.
Yeah, and she just said it, and I
lot.
thought about it. But we do play that a lot. It's almost like you're in a spa. It feels like, you know.
Yeah. Because nature has healing properties. In fact, it's like we all long to go home, with home being our roots to nature, to the earth. And so that's just something that I was wondering if the patients had windows, or what kind of ways do they get to experience the healing properties of nature. So I'm glad to hear you say that you have those channels. And the other thing that I wanted to ask you about, because I know it's a burning question, and what about PPE? Do you guys feel like you have had enough, that you've been protected personally through this invisible warfare that's going on? How do you feel about that?
I feel like it's been pretty good with the PPE. The only thing is with the mask. We will have to use the N95 for a full week. And after the first day, you feel like you need to change it because it loosens up. You know, so having to wear it 5 days a week, kind of feel like you're not as protected, because when you use, after a couple of days, then your face shield is starting to fog up. So you like, if air is being released, then air can come in.
Right.
So
I think there was a lot of unknown in the beginning. I think I heard something different every time I came to work, you know, which was frustrating. Once we were in the heart of it, the face mask we had to reuse for a couple of days, or if it broke, or if it, you know, you felt like it wasn't giving you the proper seal. But I don't think we ever had trouble getting a new one when we asked for one. They never questioned us on why. They just gave it to us. The gowns changed every other day. There was a new color, a new. Sometimes it's plastic, sometimes it's cloth, sometimes you know. But we were always covered.
And I know that Walmart was making gowns.
Yeah.
Oh, I did not know that.
I know that they were helping in some way, but I didn't realize they were.
And I know some of the car industries are making ventilators. So you talk about a global community effort.
Well, I know, you know, I've been an ICU nurse for 15 years. I've never used the BiPAP machine as a ventilator. It was something that I had to learn, and I YouTubed it. I had to YouTube how to convert a BiPAP machine to a ventilator. I didn't even know we could do that.
And that's how we roll, right?
That's how we roll. Yeah.
So, okay, you guys have answered all of my questions. I don't know that we have had any questions from the audience, but anything else you guys want to talk about, or?
Yes, I have a question for you, Professor Swill. About these awesome shirts. I don't know if anyone else can see these shirts.
Hold on, let's bring them up closer.
And then the back. Probably not that great of a view of it. But I just would like to know your story behind these shirts and what made you.
It's a crazy story. But the story is that, seriously, God woke me up one night and said, you need to make a t-shirt. And I'm like, for what? What kind of, I mean, I don't even have the money for this. What are you talking about? T-shirt. And as I reflected on that, and having this year of the nurse, because Florence Nightingale said that in 150 years, which was in the time she was practicing, she said in 150 years, nursing is going to evolve to what her vision of nursing is. So it was 2020. So since the late 1800s, we knew that the year of the nurse was going to be 2020. And it's ironic that on the year of the nurse, we're experiencing a pandemic that we've never experienced before, and how it has changed our profession. And so our ancient profession is taking on a new look probably for the rest of our careers. It's looking different because of what's happening during the year of the nurse. And I knew that I've always wanted to do some kind of nursing scholarship. But I knew I didn't have the money just to say, okay, here is money to put this nursing student through nursing school. And so I needed some way to expand my vision of what scholarship meant. And the way that I expanded it was that I thought, okay, if I can create something that makes money that I can use to give to nurses that have been affected by COVID-19, maybe in ways of like mental health counseling, some, paying some bills because they've been furloughed, some student loan payments, maybe it is academia, maybe it's something that I can give money to a lot of people in scholarship. And so I created these shirts to sell and use the profits to benefit nurses that have been affected by COVID-19 on a global lens. Now, we do have several different countries also members that are nurses in other countries, members of our Facebook page. So I'm not looking at a small lens, I'm looking at a global lens because this is a global pandemic, and we have fellow colleagues in other countries that are experiencing the same thing that we're experiencing with a lot less resources than what the United States can draw on. So the masks on the shirt is to resemble the resiliency of our profession, of the nurse. Like you said, you're wearing the same masks day after day. And so the mask, I wanted it to look tattered. I wanted it to look worn and used. And I wanted it to symbolize the resiliency of our nurses. And then the other part was just, it's the year of the nurse, 2020. We've been planning activities for the year of the nurse for, decades. And it got here. And it brought with it something that we never expected. And so you'll never have another year of the nurse as declared by Florence Nightingale. And we'll probably never in our lifetime see another pandemic like this. And so the two came together. And that's how I got. I used her quote on the back of the T-shirt that she said in 1870 that in 150 years, nursing will be what I envision. And so does that answer your question?
Yes, I think it's really creative. While I was at OCU for SNA, we should have came to you for ideas for our T-shirts.
Oh, okay. I have a question from one of the viewers to the nurses. Has this pandemic made them question if they want to continue their careers for fear it has, for fear, or has it strengthened their desire to continue? Who wants to answer that?
That's a really good question. And I think that in the beginning, I questioned that every day. And I'm probably gonna cry.
And that's okay. Because we'll all probably be crying.
I always wanted to be a nurse. I never thought I would work during a pandemic. I never, I hate when people say I never signed up for this because, we knew obviously that this could happen. I guess it could always happen. I guess I never thought I would be doing it. And I was afraid. I was really afraid.
Oh, yeah.
of what it was going to be, of if I could handle what I was about to see. And after I worked a full week, I was very proud of myself.
As you should be.
I was proud that I could be a pediatric nurse and take care of an adult and know what I was doing. And I was so proud of my coworkers. And it just made me so happy that we worked together every day. And I'm proud of my profession. I really am. I'm really proud that I'm a nurse. I don't think I can do anything else. I know I'm educating 3 kids at home and I can never be a teacher. So, no.
I never thought I could be a teacher either.
Teaching nursing, that wouldn't be so bad.
I love to hear you say that you're proud of your profession.
I am proud of my profession. I'm proud of every nurse and how they handled this. You know, I'm sure every hospital or every nurse could say the same thing. I hope they could. As far as me and my coworkers, I'm proud of us. We did a good job and we were so together when we needed to be together. So it was good.
I love that answer.
What about you? I'm proud of all the teamwork for sure. And when I first came to the PICU, I didn't know that these nurses hadn't had any adult ICU experience, because a lot of them, I'm like, they handle it very well, and it was with confidence as well. So you wouldn't have guessed like this was their first time in a adult ICU. Yeah. But for me, the first week was very rough.
Yeah.
It strengthened me. It strengthened me big time. Because especially to see how much support I was able to provide, not only for the patients, because when I became a nurse, I really just thought, I would be helping out patients. I didn't really think that I would be able to provide so much support to my peers. So it was a really great thing just to be able to be there for both sides, the patients and also my peers.
And so many of nurses are giving sacrificially, and that's why they call it a calling. I mean, it is a calling, and there's going to be some nurses, I believe, that will leave the profession, and some that this will draw more people to the profession. So saying that, and me being a nurse educator, just remember to be really patient with our students that are graduating and coming out to this new role that we're trying to teach them that we've never even experienced. So I love hearing how proud you are of the profession. I'm so very proud as well. So now that we've cried.
I cry very easily. So.
Is there any more questions from that's okay. I guess that's all the questions from the audience. So I know you guys have worked a full 12-hour shift today. So I want to respect your time. And I want to thank you so much for doing this for us and sharing your stories and your experiences. And I know that everyone else would want to send thanks to you as well. So I wish you both a good night, good rest, and a good career going forward.
Thank you.
Thank you. You as well.
Thank you.
Thank you. So, okay, we'll go ahead and sign off. So thank you.
Thank you.